Namaskaram and howdy y'all. So I meant to make this video last week after I read an article by a woman who I think she terms herself as like a lifelong or long-term professional psychiatric patient. She had been on various medications, misdiagnosed or re-diagnosed several times, and it was about finding an off-ramp to our current psychiatric model. Y'all know, if you've seen my videos, I'm a big fan of that. I've spoken about that. Not just an off-ramp, but first-line solutions. That's why I push things like TMS, or transcranial magnetic stimulation, various forms of ketamine. And you have to focus on things like sleep hygiene, exercise, diet, stress reduction techniques. How is their marriage, relationship, home life going? All these things. And the current model pushes pill pushers, medication managers, no one likes to be called that, but that's what most of us are, to just see as many people as possible rather than focusing on quality care. So most of y'all spend 10, 15, maybe 20 minutes with your follow-up patients. That ain't gonna do. That ain't gonna do, son. You have to focus on those things. It isn't the responsibility of the therapist or the primary care or the social worker or this person or that person. It is also your responsibility too. Because it might not be a medication issue. It might be a lifestyle or behavioral issue. Or it could be something else, and you have to rule that out. That is on you and me. So please focus on those things first, but then don't just jump the gun to psychotropics, right? Because most of them are garbage. Now, if you are on a current regimen of medications, especially if you're part of what we call the severe mental illness population, so schizophrenic disorders, bipolar mania, things like that, I'm not telling anybody, even the worried well, we call her, just on anxiety or antidepressants, I'm not saying quit them. You know that in the past, if you've seen my videos, work with your current healthcare team or transition safely over to a healthcare team that fits what you want and need, right? And then work on finding better solutions. So yes, we do need to find better solutions, because we can't just keep pushing those pills and making it a merry-go-round or revolving door system. And we need to focus on those frontline, those first line interventions. We have to do that because people aren't getting better. They're not. We're just slapping band-aids on there, all right? And that's not gonna do. So please, do what you were meant to do and be a good provider. And that goes for me as well, okay? But please work with your patients, figure out what's really going on with them, push them kindly, be their cheerleader to find an off-ramp solution and to take